About a quarter or a third of patients actually achieve long-term remission. And that means there's about 70% plus of patients who are just grumbling along with low-grade symptoms that they've got used to and they cope with and they manage with, but they're not normal. So achieving complete remission is only possible, it seems, in about 20 to 35% of patients. 2/3 of patients will achieve a response overall, but that doesn't mean to say they're in remission. Once a patient's escalated onto biologics, and I suspect many of you are on biologics or are about to start biologics, over time there is a loss of response, and how we deal with that and what we do next is a question that we're all grappling with in the gastroenterology world. Other concerns that the clinicians and the patients will always discuss is what are the long-term risks, and everybody's biggest fears are about certain types of cancer, in particular blood disorders called lymphoma, and various peculiar infections. And I'm going to just take this opportunity because lymphoma risk with azathioprine, infliximab, are fears that everybody has. But I'm going to give you some context to these fears, because there's what's called relative risk, which is the risk of you as an individual patient having a lymphoma compared to somebody who doesn't have colitis or isn't on TNF, and then what's called the absolute risk. So the absolute risk is, your risk is 1 in 100,000. The next person who's on infliximab has a 2 in 100,000 risk. Therefore, they've got double the risk, therefore the patient's scared. If the patient's got twice the risk, they're terribly frightened. But if it's 1 in 100,000 versus 2 in 100,000, the relative risk is trivial. The absolute risk is trivial. So let me just show you. This is